Skilled nursing facilities, or better known in the jargon of Medicare as SNF, is the cause of much consternation among people on Medicare. The reason for the distress and stress is because Medicare beneficiaries are sometimes denied coverage. This both confuses and angers Medicare beneficiaries because there doesn't seem to be any rhyme or reason to some of the denials. From my observation over the years, doctors' offices sometimes don't follow the Medicare protocol. I understand everyone is busy and people are certainly well-intentioned, but Medicare is insurance, and insurance has rules, protocols, and forms. I've observed that some of the denials are caused by a lack of adequate explanation to Medicare and/or the insurance companies. And sometimes a situation does not meet the criteria that Medicare has established for skilled nursing care. That's why you're denied. When skilled nursing is prescribed, 5 essential criteria must be met. First, the stay in the hospital. All right. Medicare beneficiaries must stay as an inpatient for 3 consecutive days in the hospital. Each of these is an essential ingredient. The beneficiary must be admitted to the hospital as an inpatient. If the patient is only admitted for quote-unquote observation, she won't qualify. She must be an inpatient. Next, the stay must be consecutive. It can't be a day or 2 within a short period of time. It must be at least 3 consecutive days. And finally, it must be at least 3 days, not counting the day of dismissal. Many times people assume the day of dismissal counts, but that is definitely not the case. 3 days of inpatient care at least, with the 4th day for dismissal. Sometimes people complain that the patient doesn't need a 3rd day, but if you want Medicare to pay for it and for her to qualify, she must stay at least 3 consecutive days. The second criterion for Medicare to cover a skilled nursing stay is the admittance must occur within 30 days of dismissal from the 3-day stay in the hospital. My mother-in-law had an open heart surgery a while back. Her cardiologist prescribed that she stay in the skilled nursing facility for cardiac rehab. She was not a cooperative patient. She refused. My wife was insistent and explained that if she didn't go then, she would lose the opportunity for skilled nursing rehab. My mother-in-law's response was she would do it later if she needed it or wanted it. Many people mistakenly think they can go to a nursing home for rehab if they simply want to. It must be within the 30-day window after dismissal from an inpatient stay at the hospital. Otherwise, Medicare will not pay. Now, you may think it's not fair or right or makes sense. I'm simply stating the rules and the facts. The third criterion for admittance to a skilled nursing facility is that treatment can only be provided by a skilled nursing facility. What this usually means is it has to be full-time, 5-day-a-week care. In other words, the same level of treatment cannot be provided going to a treatment center by appointment a few times a week. Only an inpatient skilled nursing facility can provide the level of intense care needed for adequate recovery. This can be a tricky call and where judgment can and sometimes is questioned. I had a patient who had a knee replacement. Usually a knee replacement, even with complication, doesn't merit admittance to a skilled nursing facility because physical therapy is something that can be completed by going to the therapist's office and/or doing exercises on your own. This situation, however, was different. She was living in a small apartment with lots of furniture. There was a pet, I think maybe even multiple pets. The husband was feeble. While she was not very old, her knee was not recovering at the usual pace. The doctor recommended skilled nursing care, but Medicare denied the recommendation. The family came to me with questions. I suggested they explain the situation to the doctor in greater detail and with more urgency. She was a serious fall risk, and that's the key phrase, fall risk, because of her living situation. Once the idea was emphasized sufficiently in the doctor's notes to Medicare, Medicare understood that the work that had been done would be undone if she fell at home because of a pet, furniture, or whatever. The request was approved. Skilled nursing is very expensive. Medicare needs to understand the medical necessity. That's the key phrase, medical necessity of a prescription. Once the idea is communicated effectively, things can happen. The fourth criterion is that a doctor or other appropriate medical professional certify that the patient needs the type of daily therapy that can only be performed in a skilled nursing facility, and the skilled nursing facility must be certified by Medicare. You can go to the Medicare.gov website to find out what facilities are certified and their star rating, which is very good. The fifth and final requirement can be confusing. The skilled nursing care must be for the reason the patient was in the hospital for the 3 days. Let me illustrate. Let's imagine John goes to the hospital because of a broken hip. While John was in the hospital, he has a stroke. The doctor certifies John for treatment at the skilled nursing facility, not for the hip, but for the stroke. The skilled nursing recommendation isn't based upon what the person is admitted to the hospital for, but rather what they were treated for during that at least 3-day stay. As you can see, skilled nursing stays can be complex. It's important to have some understanding so you can know what to expect or not expect when it comes to major medical treatments, and how to navigate the processes to your benefit and the benefit of your loved ones. My name is Chris Grimond, Omaha Insurance Solutions. Please like this video. If you would like help with your Medicare planning, give us a call.